Mr. Chair. Mr. Chair, in the Confederation discussions, George Brown famously said that going from province to province is like going to a foreign country. But he said the Confederation proposal is to throw down all barriers between provinces to make a citizen of one, citizen of the whole. Does the minister agree with our founding fathers that we should throw down all provincial trade barriers?
Well, Minister.
I certainly do.
The honourable member.
When will you do this by?
Minister.
As I said to our respected colleague from Quebec, I respect the jurisdiction of the provinces, and I respect...
Well, member.
Did you, at your meeting with the First Ministers, did you discuss internal trade barriers?
Again, through the chair, the honourable minister.
We surely did.
Well, member.
Premiers draw up a list of internal trade barriers.
Well, minister.
We have a list, and the premiers were very vocal about their intention to move with alacrity.
The honourable member.
Would the minister provide this House a copy of that list?
The honourable minister.
In fact, it is a matter of public record what the exemptions are of each province and territory in the federal government.
Member.
I didn't ask what the exemptions were, Minister. I asked if you would provide a list that you drew up for the Minister's meeting.
Again, through the chair, the honourable minister.
Exemptions are a list.
Well, member.
If a province does not want to remove a barrier voluntarily, will the Liberal government coerce the province to remove it?
The honourable minister.
I think there is a wave of patriotism in Canada. I think we are ready to trust each other and to work together. It is in that spirit of collaboration that I intend to work.
Well, member.
The minister spoke about a number of the memorandums of understanding between provinces. For example, the Ontario and New Brunswick MOU says that it is not legally binding. Does the minister believe non-binding commitments are enough to create one Canadian economy?
Honourable minister.
The member opposite is a newly elected MP for Ontario. Perhaps he and I differ in the degree of trust we have for the Premier of Ontario. I believe he is a man of his word and will live up to it.
The honourable member.
The trust we have in our provincial premiers is not at issue. The question is, does the minister believe that non-legally binding commitments are enough to create one Canadian economy?
The honourable minister.
In fact, I think the member opposite's questions are directly about questioning the sincerity with which the premiers of Ontario and New Brunswick are approaching this issue. I choose to trust them and believe they want to make.
The honourable member.
Mr. Chair, the Canadian Cancer Society said this week that cancer is hard already. Accessing treatment shouldn't be. Does the minister agree?
The honourable minister.
If the point of the question is to say we need to make it easier for healthcare professionals to work across the country, I 1,000% agree.
The honourable member.
Glad to hear that. So I assume then the minister believes that the lack of cancer care and access to drugs and treatment is an internal trade barrier.
The honourable minister.
No, I didn't say that. I chose my words precisely, with care. I do believe one of the things we need to do is make it easier for healthcare professionals, make it seamless for health.
The honourable member.
Let me ask her directly then. Does the minister believe that the lack of cancer care access, the lack of access to treatment, to drugs, is an internal trade barrier?
The honourable minister.
I believe as an internal trade barrier is the fact that healthcare professionals cannot move freely across the country and cannot offer their services across borders. That is not good enough, and that is one of the things that we're going to change.
The honourable member.
I agree with labour mobility. That was not the question. The question was for patients' access to care and drugs and treatment. Is that an internal trade barrier?
The honourable minister.
I actually did address that in my answer. I do believe part of removing internal barriers to trade is making the movement of goods barrier-free, making the movement of people barrier-free, and making it possible to provide services across borders.
The honourable member.
Minister, when will cancer patients have access to all types of treatment, drugs, in all parts of Canada?
Honourable minister.
Again, I was clear. Part of the work of removing barriers to interprovincial trade absolutely includes making services frictionless and barrier-free and allowing them to be provided across the country.
The honourable member, last question.
Does the minister know the value of lost wages, out-of-pocket expenses caused by the lack of access to cancer treatment because of internal trade barriers?
Minister.
The Conservatives seem confused in their questions. On one hand, they want to say that we are overstating the value of removing internal barriers to trade. On the other hand,
Resuming